The Washington State Department of Health's Chief of Public Affairs, Elizabeth Perez, gives a heartfelt acknowledgement of past harms and a pledge from the department to improve health equity.
We at the Department of Health understand that our mission to protect and improve the health of people in Washington State cannot be truly realized without addressing the health inequities and historical trauma and systemic racism that has disproportionately affected our communities of colors, particularly Black and African American individuals. We are acutely aware that the government system's past is shadowed by systemic racism manifesting in long-standing health inequities. This legacy from the neglect and disfranchisement of marginalized communities in both public health and healthcare initiatives deeply play the entrenched biases that influence the care received by Black African American patients and continues to have profound implications for the health and well-being of individuals. We acknowledge the enduring impact of past atrocities of racism, such as medical experimentation of Black individuals without consent, like the Tuskegee syphilis study and the commodification of Black bodies as seen in the case of Henrietta Lacks. These events have shattered trust and cultivated fear within the Black African American community towards the healthcare and public health system and government systems, and we deeply regret the repercussions that continue to unfold today. So we can recognize the societal conditions that influence health which disproportionately affect Black and African individuals, including structural factors such as the lack of access to quality education, affordable housing, adequate nutrition, and equitable employment opportunities. This intersection between health and social factors underlines and perpetuates health disparities. While we cannot erase the history, we can and must acknowledge and learn from it in order to inform a more equitable future. We commit ourselves to confront these systemic issues that perpetuate health disparities and to intentionally create an environment of care that respects, listens, and values the voices of Black African American communities and all communities of colors. In pledging to do this work, we strive to recognize and address health inequities, promote cultural responsiveness amongst our teams, across our agency, and among our leadership to engage in advocacy for health equity and establish partnerships with community leaders and organizations to ensure our initiatives reflect the needs of the communities that we serve. We firmly believe that everyone in Washington State deserves to live the healthiest life possible. And this commitment to address health inequities represents not just our moral responsibility, but also our pledge to build a healthier and more just future for all Washingtonians.